Dr. David Barron. I'm a family physician, which is a family doctor, a family medicine specialist. My office is in Malibu, California, right on Pacific Coast Highway. Been here in this office for 17 years. And I have a concierge model practice, which means I have few patients compared to most doctors and have a lot of time to spend with them and connect with them and really give them the time they need. They have my cell phone number. I make home visits. On a good day, I make a home visit. I see a couple patients in the office. I do a lot of email and texting and other communications with patients and with other doctors and nurses. So it's very varied. I see young people and old people and people who are being born and people who are dying. So I also do radio commentary. I've been called by KNX News Radio dozens of times over the past 10 years to comment on medical matters. And during the early part of the COVID pandemic, they had me on 3 times a week answering listener questions for quite a while. All right, really quick story. When I first started practicing in Malibu, I didn't come here because it was a famous place or because there were celebrities, but there are celebrities. There are a lot of famous people in Malibu. Not everybody is, but some are. And a number of them were patients of my previous partner, the guy I started out in practice with. And the first summer I was with him, he went on vacation, left me with the keys to the store and said, "It's all yours." And one day I found myself with 2 A-list movie stars in the office at the same time, both of whom were his patients, and who knew each other, and were both kind of big egos and jokers. And I won't drop any names because it's not appropriate. But I went into one room and found this famous patient in there who asked me, to do something for him. And I said, okay, I need to check on another patient across the hall and then I'll be right back. I went across the hall and there was another, huge movie star in there. And I knew they were friends because I'd seen them in the past chatting. So I told the second guy, that I asked him if he'd like to play a little joke on the first guy, and he said, yeah. So I put my white coat on him, I gave him the chart, I had him go knock on the door of the other guy's examination room, and the patient said, come in, and in walked this other movie star with my white coat on and the chart, and said, so, what can we do for you here today? And the other guy says, oh no, not you! Okay, I'm over time. Thanks for considering me.